खत्म हुई प्रतीक्षा, खत्म हुआ इंतजार। एक छोटे से अंतराल के बाद हम हाजिर हैं कम्युनिटी लाइनअप के साथ। मैं हूं विकास नांगिया। यूएस सर्जन जनरल डॉक्टर विवेक मूर्ति बीते सप्ताह ऑस्टिन टेक्सास में थे। इस दौरान उन्होंने 2 समारोह संबोधित किए, पहला यूनिवर्सिटी ऑफ टेक्सास में और दूसरा IACT इंडियन अमेरिकन कोलिजन ऑफ टेक्सास द्वारा आयोजित स्वागत समारोह। ओबामा एडमिनिस्ट्रेशन में महत्वपूर्ण भूमिका निभाते 38 वर्षीय डॉक्टर मूर्ति बहुतों के रोल मॉडल हैं। उनसे व्यक्तिगत स्तर पर मुलाकात करने और उनकी उपलब्धियों के लिए उन्हें शुभकामनाएं देने IACT मीट एंड ग्रीट रिसेप्शन में अनेक शामिल हुए। 19th यूएस सर्जन जनरल डॉक्टर विवेक मूर्ति की उपस्थिति इंडियन अमेरिकन कोलिजन ऑफ टेक्सास सदस्यों के बीच खुशी की लहर ले आई। सभी उनसे व्यक्तिगत स्तर पर मुलाकात कर प्रसन्न थे। प्रिवेंशन इज द बेस्ट क्योर, इस सिद्धांत को जहन में रख डॉक्टर मूर्ति ने प्रिवेंशन बिहेवियर पर चर्चा की। साथ ही साथ इस अवसर पर उन्होंने समुदाय की खूब प्रशंसा की। डॉक्टर मूर्ति ने कहा कि यूएस सर्जन जनरल बनना कठिन था, ढेरों चुनौतियां थी, लेकिन कम्युनिटी के सहयोग ने महत्वपूर्ण भूमिका निभाई।
This community also played an important role for me recently. You know, as some of you know, when I was nominated by the president to serve, as Surgeon General, I had to go through a Senate confirmation process, and there were some challenges along the way. But a big part of what helped us get through those challenges was the support of this community, and I must tell you just how grateful and heartened I was just to see so many people, some of whom I knew, many of whom I didn't know, just to stand up and be so supportive during those difficult times. The people who made calls, who made visits, who made it clear that this was important for the community. I will always remember those stories and what they did.
What are the biggest healthcare challenges that you see in the U.S. right now?
Well, the big challenge we have in the United States is that we focus the majority of our time and effort on figuring out how to treat illnesses and not nearly enough on figuring out how to prevent them. And we have to shift that. We have to create a culture of prevention in America. And to do that, it's not going to be easy because we have to change how we approach health. We have to make sure that physical activity and the good nutrition and emotional well-being are the cornerstones of our communities, and make sure that we are supporting and promoting behaviors that ultimately prevent illness. And if we can do that, if we can build that culture of prevention in America, then I believe that we can alleviate death, suffering, and save ourselves healthcare costs along the way.
Yes, perfect. Thank you so much for bringing that awareness to the country. I mean, it sounds so obvious, but nobody has focused on it, right?
Well, there are people who have focused on it before, but we need to do a lot more right now to really turn the tide and ensure that we have a strong focus on prevention in America. Because if we don't, then what we will see is growing numbers of people with diabetes, with heart disease, with cancer. We'll see rising healthcare costs, and that's not what any of us want.
So as a doctor and a medical professional, what are your thoughts on Dr. Vivek's focus on prevention rather than cure?
I think it's very important. I think first and foremost, him being an Indian American physician is really great for us, great for the Indian American and physician community to have such a prominent position. I think the focus on preventative health care is an important one, something that we need to pay more attention to in terms of the changing dynamics of healthcare cost. I think prevention is a real key to that, and I think it's important that we have a voice that can really clearly and eloquently speak about that and help to bring that message across to everyone.
As you realize, as a hospital, we have had traditionally success, but as we look at how we take care of people in the future, we recognize that care has to be outside of the hospital. And as hospitals, we've done really good in taking care of sick people, but health is not about taking care of sick people. It's actually prevention. So his mission, what he's out to do, and what we have to do correspond very, very well. And we feel honored to be part of this work and this journey. And as a system, as a hospital, as well as Ascension, we focus on prevention as well as wellness of the person. So given this, it's only natural for both of us to work and do this together.
It has been an evening full of odd audiences and inspirational conversations. Vice Admiral U.S. Surgeon General Dr. Vivek Murthy is visiting Austin, and even with back-to-back talks, we have had community leaders and healthcare professionals from across Texas visiting to meet with him. Dr. Murthy has been talking about focusing on making prevention as appealing as cure and how to do that, expecting the local community to play the role of a salesperson that connects and an entrepreneur that creates opportunities that would encourage people to stop considering health as a chore. This is Seema Govil for TV Asia.